Hi, everybody. We're going to get started really shortly here, but if you don't have your news outlets in your name, can you please add it to your name? That would be helpful for us. And just give us a couple seconds and we'll get going here. Okay, we're kind of getting our feed set up, so just give us 30 seconds or so and we'll get started.
Recording in progress.
Okay, hi everybody. Thanks a lot for coming. We really appreciate everyone being here. My name is Dr. Matt Hoffman. I'm a family doctor at the Allina Heights Clinic. Together with me, we have two other union members. We have Dr. Cora Walsh, who's at the Allina West St. Paul Clinic as a family doctor. And we have Nick Van Asdel, who's a pediatrician at the Allina Hastings Clinic. So I'm going to start by giving some general information about our strike and our union, and then we'll hear from Nick and Cora, and then we'll answer some questions. So our union is part of Doctors Council SEIU. We represent 600 Allina primary care and urgent care doctors, NPs, and PAs. We're spread across 61 clinics. When I speak, I'll refer to this group collectively as primary care. Today, we are announcing a one-day ULP strike on Wednesday, November 5th. On that day, we will be picketing at 3 clinics. We will be picketing at the Allina Coon Rapids Clinic, the Allina West St. Paul Clinic, and the Allina Richfield Clinic. We have been bargaining with Allina as a union. This is our first contract. We've been bargaining for about 20 months. We voted to unionize October 13th, 2013, and started bargaining February 2024. Over that time, we've had 60 bargaining sessions, a little over 60 bargaining sessions. We do have tentative agreements that we've come to that we do feel really will improve primary care at Allina. Specifically, we've really sought to improve autonomy and control over patient care to our providers as opposed to Allina management. We have important articles regarding scheduling, safety, a new labor management committee, and also protection against unfair discipline and termination for our members. However, even after 20 months of bargaining, among other issues, Allina is refusing to bargain over safe staffing levels for our clinics. They're refusing to bargain over things that we consider basic contract items like healthcare, retirement, and sick leave. And they're trying to cut wages for the majority of our members. The strike that we're announcing is not by any means a surprise to Allina. We have really tried everything we can do to avoid a strike, to get to a contract without striking. Allina has known that our union is very serious about getting to a fair contract. Our members have been extremely active and motivated during this entire contract campaign. We brought dozens of members outside of the bargaining team to many sessions to explain to Allina what we need in a contract to improve primary care. We've shown Allina with a rally, with an informational picket. This summer, we took a strike authorization vote. We've shown them that we're really serious about this contract, that we need to see a contract that's going to improve primary care. At this point, where we are, we do not see a way to make further progress if we do not announce a strike. And today we gave Allina a 10-day notice of strike. The bargaining team unanimously voted to do this. If we don't do this, what we're looking at is taking what Allina is offering, taking what's on the table. And really the fear of that is that if we do that, we are going to see primary care continue to get worse at Allina. I feel I'm sure I can speak for Nick and Cora, but I love being a doctor. We love being doctors. We love caring for our patients. But we have seen so many of our colleagues leave primary care. We've seen so many of our colleagues get burnout, cut back their hours, not be able to care for as many patients. We cannot let that cycle continue. We feel that we have to fight for a fair contract if we're going to see any improvement through primary care. We did choose a one-day ULP strike to minimize the impact on patient care. We certainly recognize that our patients are going to be affected by this strike. However, if we don't strike, we are accepting more cuts to primary care. And we certainly feel that in the long run, these cuts will undoubtedly affect patients much more than any strike. We do bargain twice before the strike date of November 5th. We bargain on Wednesday, October 29th and Monday, November 3rd. Our hope is that through those sessions, Allina is really going to come to the table, going to work with us to get to a fair contract that's really going to improve primary care. We are open with Allina. We have tried to bargain more than they have offered. We're certainly happy to discuss more at any time and try to figure out a way to get to a fair contract and potentially call off the strike if we can get there. I'd like to pass it off to Nick Van Osdell to speak a little more.
Thanks, Matt. So Nick Benazzel, I'm a pediatrician at the Allina Hastings Clinic, and I've been involved with the union effort organizing for quite a few years now. And I'm hoping that today I can just kind of, through that process, talk to a lot of people in our bargaining unit, as Matt said, about 600 members, just seeing what's going on with them and keeping people updated. So I'm hoping I can just kind of collectively represent why, from a personal standpoint, we are where we're at. I think, if you wanted just one liner, it's just that a lot of us are just at our breaking points collectively. We feel like we've done everything we can to avoid getting up to this point. Even prior to unionizing, there were efforts made over the course of years and years of people trying to use appeal to logic, appeal to emotion, beg and plead to change things, both from a personal standpoint of when our own providers are struggling, but also just for trying to advocate for our patients and what we think that they need. We really feel that as providers for these patients, particularly in primary care, we know best what our patients need. And when you work with with a large system like this, and this is not an Allina specific issue, this is happening all across the country. When you work with an organization within a large organization like this, you often get told, a lot of our members have experienced being told that, they're the only ones who have a problem, they're the only ones complaining, everybody else is fine. And as we started to organize and talk to other people, we realized it just wasn't true. And for me personally, that's really what did it for me when I started talking to people about what their concerns were. It was honestly really hard to hear people using words to describe how they felt about the way they've been treated and how things were going in primary care, such as feeling beat down, feeling demoralized, feeling hopeless, feeling like all they do is just come in every day and punch the clock and punch out. And that's just not how primary care works. People feeling like, the message that we're getting is we feel that we are replaceable, and that we're just a product on a shelf that can be taken down if it's spoiled or broken and just replaced. And that's not how primary care works. Primary care, it runs off relationships. It runs off of people staying in for the long haul with their patients and really caring. And you can't do primary care 2-3 years at a time. As Matt said, people are leaving their jobs, switching to other areas of healthcare, leaving healthcare altogether. People are retiring early. There's a reason why you might have to wait a month or two just to see your primary care doctor. We don't have enough doctors and healthcare providers. We felt like the time to stand up was now, not 5 or 10 years from now, when there's just no energy left to fight this. We need to fight this now. The time is not after they've seen another clinic close, after we lose more resources, after we've seen the healthcare systems pull out of more small town communities. The time to fight is now, and we know what's best for our patients and for ourselves for kind of fighting back on that burnout and what we call moral injury, where we feel like our ethics conflict with what we're expected to do in our day-to-day work. And we've really not gotten the sense that Allina is willing to listen to us at the bargaining table, so we're taking the next step.
Thanks, Nick. Now let's hear from Cora Walsh.
Hi, I'm Cora Walsh, a family physician at the Allina West St. Paul Clinic and a member of our Doctors Council bargaining team. From the start, our goal as a bargaining team has been to secure a contract for our members that will protect primary care providers' ability to serve our patients at the high standard of care we know they deserve. Going into primary care, as you've heard others say, is much more than a career choice for us. For most of us, it feels like a calling. Yet, as we watch cuts to primary care in the name of the bottom line, corporate growth, or running lean, it means that to deliver the care our patients deserve, we continue to give more and more of ourselves, leading to high burnout rates and providers either cutting their work hours or leaving the field entirely. We know what it takes to make primary care sustainable and to provide the high quality care our patients deserve. This is what we are fighting for at the bargaining table. Yet 20 months into bargaining, we still have many critical issues we have yet to see any progress from Allina on. Months ago, we proposed the minimum staffing necessary to support a day of clinical care, including adequate ratios of clinical assistants and nurses, as well as other critical services such as lab and x-ray. In the months since we made this staffing proposal, Allina has not only refused to bargain over this, but have meanwhile sold our clinic labs with dramatic impacts to patient care and have announced cuts in x-ray services as well. If dramatic sounds like hyperbole, you could ask any of our patients who now often wait over an hour after seeing their provider to have their labs drawn due to staffing shortages, or the patients we've had to send to the ER because we can no longer get timely lab results or the x-ray needed to care for them in clinic. Allina has also failed to meaningfully engage with our proposals to value and protect time for the administrative work we do outside the exam room, often late into the evening hours. Further, Allina continues to refuse to bargain over important benefits such as health insurance coverage, coverage of expenses related to our licensure and continuing education requirements. And even though state law now prohibits new non-competes, Allina has refused to entertain language releasing healthcare providers from our pre-existing non-competes. Finally, Allina's proposed pay structure amounts to, on average, a pay cut for primary care providers. This is particularly alarming in the context of general cuts to primary care, with Allina recently now announcing multiple clinic closures, while executive pay has increased in recent years. Without Allina meaningfully bargaining on these issues, we do plan to strike, a decision that has been very difficult for us to come to. We do not want to be away from caring for our patients, to put our patients in that position, but we really feel Allina has forced our hand. This is what we feel we must do in order to ensure a primary care workforce will be there for our patients year after year.
Thanks, Cora. Before we get to questions, I did just want to expand a little bit on some of those things Cora was talking about. I also want to say that private healthcare providers, primary care providers, have never unionized at the scale that we have at Allina. And this is not a coincidence. This did not happen in a vacuum. This happened as a result of how Allina treats primary care. People, I think, had to be really pushed really far to get to the point of saying our option is to unionize, because it's so difficult to unionize. It's difficult to become a union. It's difficult to bargain. But what we have seen over the last 5 years, we have seen 3 birthing centers have been closed in Allina, resulting in patients having to drive, an hour sometimes to give birth. We've seen recently 5 clinics have been closed in Allina. Together with those 5 clinics being closed, 4 of the providers were laid off, which is incredibly unusual in primary care. And there really is not a plan for how to take care of those patients. I think, as you probably all know, it's already hard enough to see a primary care provider. The fact that Allina is laying off providers is a huge red flag for us as we consider a strike. When Allina makes these kind of decisions, your doctor, your PA, your MP is not involved in these decisions. No rank and file worker is ever involved. These are executives making these decisions without any input from the people that really care for patients. At the same time, they're making these cuts. Allina routinely gives huge raises to their executives. In the last set of tax documents we have available, Lisa Shannon got an 11% raise. So that's from about 2.7 million to a little over 3 million. So it's very difficult for us as providers trying to take care of patients, hearing, okay, we're able to give our executives huge raises, but we're not able to offer our patients, the nursing services they need, the lab services they need. That's really, I think, what's brought us to this point, is seeing really how Allina treats primary care, and certainly in contrast to what happens with these high executives that are making these decisions to cut care. All right, so with that, let's open it up for questions.
Do you want us to jump in by audio or write it in?
Yeah, if you can jump in, or if people want to raise
Okay.
hands, that's fine too. But yeah, Jeremy, if you have a question, go ahead.
I just wondered, I mean, you had said you'd gotten about 90% support for the ability to call a strike when the vote was taken. Do
Yeah.
you have a sense of, I mean, it's a bigger step to actually do this, even for a day. Do you have a sense of how much of your membership is going to go for this at this point?
Yeah, we certainly track that as a union, and we absolutely have a very strong majority of people that have already told us that they're willing to strike. Certainly.
Could I ask, do you have any numbers around how much wages will be cut? And also I wanted to ask about benefits like health insurance coverage, if you have any details on that.
So for cut wages, it's a difficult answer to give you like a straight, okay, this is the percent, because it really depends on the person. We have a huge variety of people within primary care, pediatricians, family doctors, urgent care, people that work float. So what we're looking at for the average provider is probably around a 5% pay cut, but it could be much higher depending on things like levels of production and how many patients you see. In terms of, can you ask that second part of the question again, if you don't mind?
Yeah, what are the health insurance benefits you're looking for and that they're refusing to provide?
Yeah, really, I know it sounds very basic, but we're looking for Allina to just be willing to codify the benefits that they already give us in a contract. So we're actually not asking for improved benefits. We're just saying what you have now, we want to have in a contract, because I think as many people see in many industries, companies change those benefits all the time. And so we just want them locked up within a contract. We're not asking for even better benefits than we get now. And that's really typical of a lot of things we're asking for. Same thing with retirement, same thing with some leaves of absence. We just want what we have now in a contract so that Allina can't change it in the future.
Quick question about oh, sorry.
Yeah, go ahead, Alyssa.
Oh, I was just asking since no one else was. I had a quick question about the non-competes. Is your contract renewed every year?
So we currently don't have a contract, and so that's a big issue. Is when you start working for Allina, you have basically an offer letter, but we don't have a contract. We've never been able to negotiate with Allina before, so this will actually be our first contract.
Oh, you mean
And
like individual physicians did not receive employment contracts previously?
that's correct. Yeah, we have like employment agreements, and those have non-competes in them. So like when you originally sign your employment agreement, it could be 20 years ago, it could be 30 years ago. They are still enforcing those non-competes even though the law has changed.
And there are no like term limits on the agreements?
That's
I
correct.
can jump in here. Yeah. So I can give you a personal example for me. I started with Allina 8 years ago, and I was required to sign an employment agreement. Essentially, if you read between the lines, well, really, no, it's actually right in there, is really that agreement is there to protect Allina and not to protect us as providers. There is no timeline or time limit on the agreement of employment. Some people might refer to that as a living contract, but yes, there is non-compete language in there that we sign off on and that they hold people to, and it doesn't expire. We don't have to re-up it. And really a lot of language in there just says that Allina is allowed to change any components of that agreement at their discretion.
Thanks.
Jeremy, did you have a question?
It was just a quick nuts and bolts thing, because I mean, I don't know if it's just the strike lasts 9 to 5 traditional clinic hours, but don't you also have some urgent cares with night hours? Just kind of when is the start and end of this walkout?
So the strike is starting at 7 a.m. on November 5th and will end at 7 a.m. on November 6th.
Hi, it's Erica Zurich from NPR News. I may have missed this in the beginning. I was having issues logging on. Did you say that the strike is going to take place across different clinics and hospitals and urgent care centers in the state?
Yeah, that's exactly right. So the strike will encompass all 61 primary care and urgent care clinics at Allina. This is over 600 providers. And then we will be picketing on the day of the strike at 3 clinics, at the Allina Coon Rapids Clinic, West St. Paul Clinic, and Richfield Clinic. But the strike will be all 61 clinics.
Just to clarify, there is another separate bargaining unit organized under Doctors Council at Mercy Hospital that's not included in this strike, so this won't include hospital work.
Any other questions?
I just wanted to ask one more, sorry about the clinic closures and how they might have been a catalyst for this.
Yeah.
It sounds like that, I mean, how does that play into some of these other things you're talking about, like burnout and what have you? It sounds like this is a symptom of a problem in some ways.
Well, I mean, we have a lot of our providers that were directly affected by those closures, providers that were laid off, providers that couldn't find a suitable job elsewhere in Allina, and then a lot of providers that are working in a different clinic in Allina. And that's, it's a big deal to have to change your work location and potentially lose a lot of your patients. And then it's also a huge deal to the patients. Some of these patients will be able to go, to travel to a new clinic, but a lot of patients, rely on public transport and won't be able to continue seeing their providers. So it's a really big deal to us and our patients. And I think that aside from that direct effect, it's a huge sign to us that something is very wrong with how Allina is operating primary care. Allina is a nonprofit charity that is paying its CEO $3 million and cutting off access to care for our patients. And, when you see something like that happen, at the same time you're at the bargaining table trying to make the best that you can out of primary care, I think it really helps a lot of people get to the point where they realize, like, hey, if we don't do something drastic, if we're not ready to talk about a strike, this is a company that doesn't seem prepared to change its ways, frankly.
I'll just add maybe a little bit too. I'm at the West St. Paul Clinic, and we are close to the Inver Grove Heights Clinic, which will be closing. And there's a lot of concern at our clinic that we already have patients waiting to get in with providers here. As many folks have experienced, it takes a long time to get in with your doctor when you need to be seen. And we're already working people into our schedule, trying to double book patients, doing as much as we can to address that volume. But to your question about burnout, I mean, we've talked about here, we have limited staff. We've advocated for to really increase volumes in primary care. We need more staff in order to see patients. It's not just us. We're a whole care team. It's our staff that is overburdened as well. And we just can't keep adding volumes of patients without more resources. And so to see those resources being cut, like Matt said, when we're at the bargaining table, really saying we need more resources to deliver high quality care and get patients seen when they need to be seen is really disheartening.
And Corey, you had mentioned some of this earlier in your opening statement, just about the issue of after work time spent charting or spent responding to emails and things like that. Nothing in the current agreements has been done to address that. It sounds like that's still a problem or an issue.
Yeah, nothing in a meaningful way. We've really tried to address that in kind of multiple different ways with our proposals, trying to find a way that we can come together with Allina to really provide both adequate time and just recognition for that work that it's happening. Right now, that work, yeah, we're squeezing it in between patient appointments, or quite often into the evening hours. I've heard it termed pajama time that doctors are putting in, and that's one of the big drivers of burnout in primary care. We've seen that level of administrative work go up and up and up, and yet the demands for how many patients we are needing to see in clinic and how many hours of our time we need to fill with in-clinic appointments hasn't changed. There's not been a real recognition of how our work has ballooned over the past decade, really.
Hi, it's Erica Zurich again from NPR News. I'm just curious, with everything that you're saying and possible Medicaid cuts coming down the pipe here in 2027. Like, just from your perspective, what would an ideal day at work look like from you in terms of your workload and your patient work and how many patients that you see and your own work-life balance? And what would you like Allina to do to move even more forward in that direction?
Yeah, I think that's a really good question. I think what I'll answer it more specifically, but I would say that what we want to see there, I think really also is what our patients want to see there. And so I think it starts with having enough staff to do our jobs. I mean, as Cora said, it's not just us, it's the nurses we work with, it's the clinical assistants we work with, the laboratory professionals we work with. And so I think it starts with coming to work and saying, okay, I have a team that we're going to work together with to take care of a patient. And so while I'm in the exam room with a patient, I have a team that's able to look at phone calls and messages and handle some of them, triage some of them to me. I have nurses that are going to be able to come in and give education to patients while I kind of see the next patient. So to answer your question, it's like I want to come into work. I want to have a team that's ready to go to see a patient. So when I see a patient, I'm really able to focus on what they're there for, what their needs are, without really having to be distracted by things like paperwork and kind of in-basket type messages. And then when I finish with my patient, I want the nurses I work together with to be able to come in and give the patient immunizations and, provide education if needed. And then that patient goes to the lab, gets their labs quickly, and is out the door. If they need to schedule an appointment, I'd love the front desk to say, oh yeah, hey, Dr. Hoffman has an appointment available next week, because we have lots of people working in primary care, lots of people that are ready to see patients. I mean, that I think is what I want. I think that would make lots of us very happy. But I'd be curious to hear Nick and Cora address that as well.
Yeah, I'll jump in. I would like to work in an environment where I didn't have to be adept at using the fax machine and the copy machine, because I have to do that work on a regular basis by myself. We have this concept at Allina that they're now calling team rooming, and that concept came from not having enough nurses. And honestly, team rooming is the word or the phrase that they use to refer to when there's more doctors in the building than nurses, and that should never happen. Our nurses are also getting burned out and overworked. In pediatrics in particular is a very nursing heavy specialty. There's a lot of prep and things that have to do to get the patient ready in the room before I walk in. There's a lot of things that have to happen after I leave the room. And time and time again, we see promises, but changes that are short-lived or not seen through at all. We see little improvements of this stuff here and there, but really, the other thing that Matt and Cora have brought up is the amount of paperwork, and we're trying to, with multiple ways with the contract, trying to make that better, is just to make some protected time for us to get paperwork done. I'd like to personally see, there is some of this, and we've been seeing it, but there's a lot of ground we could make with just better use of technology to make our working more efficient, make the tools we already have more efficient. For me personally, I think it starts with nursing staff. Having enough nurses to be here to do the work without them feeling like they're running around behind constantly. They're staying late. That's not sustainable. We lose nurses that way too, and it makes things worse.
Thank you for answering the question.
Yeah.
If I may jump in with one more,
Sure.
I don't know if you or if a union official could address it, but there was a mention of scope and history and the size of this event being significant. And I don't know where that information came from, if anyone has a sense of if this would be the largest of its kind in terms of the number of doctors involved, but I just wanted to get a little more sense of where that notion came from.
Yeah, well, we know we're the largest union of private healthcare providers in the country. By healthcare providers, we're talking about doctors, NPs, PAs. So we are the largest private union of our kind. Certainly the largest primary care union, outpatient primary care union in the country. We know there's been a handful of strikes of healthcare providers in the past, but there just hasn't been any near this scale ever. That we're aware of. And I did some research before this and just kind of double checked, but yeah, certainly nothing close to 600 plus primary care providers.
This is also, I believe, the first time in Minnesota history that physicians have called a strike.
Yeah. All right, maybe one or two more questions, if anyone has any. Okay, well, as I said, we are going to be bargaining on October 29th and November 3rd. We do plan to release some information to press after those bargaining sessions to keep people updated. We really appreciate everyone coming. And again, we hope that we can avoid this strike. We hope we can get together with Allina and really see them come to the table and make some improvements in primary care. Thanks a lot, everybody.